Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhitha. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life. In this program, I am going to talk about acne and what you can do about this. First of all, let us know the symptoms. The presence of blackheads, whiteheads, pustules, or even cysts with or without redness and inflammation around the eruptions is the main symptom. In adolescence, the outbreak occurs mainly on the face, but also on the shoulders, on the back, on the neck, and on the buttocks. In adults, it is usually confined to the chin and jawline. For women, symptoms may worsen before the start of each menstrual period. Groupings of red, inflamed cysts, also known as cystic acne, can be seen, and even poke marks and scarring can occur in chronic acne. Now, let us know some basic information. Acne, a skin condition technically called acne vulgaris, is the bane of millions and millions of teenagers, but it also strikes adults with its persistent and recurrent blemishes. In the sense, red bumps, whiteheads, blackheads, nodules, or even cysts on the skin. It primarily affects adolescents, but one study indicates that even in their 50s, 6% of men and 8% of women continue to experience outbreaks. Except in severe cases, acne is generally harmless, although it can cause considerable psychological distress. In both adults and adolescents, acne develops when oil glands in certain parts of the body, mostly glands associated with the pores from which face, chest, and back hairs emerge, secrete too much sebum, the thick waxy lubricant that acts to retain moisture. Excess sebum clogs the pores. If it remains beneath the skin, it results in whiteheads. Blackheads occur if the plugs of sebum protrude above the skin. Angry red pimples appear if excess secretions invade and inflame surrounding tissue. The more extensive the inflammation, the more likely it will form abscesses and leave permanent scars and pits. Prompt medical treatment of severe acne will help prevent scarring. Now let us know the causes. Acne's causes at any age are not completely understood. As in adolescents, acne flare-ups in adults are linked to various kinds of hormonal changes. For women, the hormonal fluctuations that accompany menstruation appear to be a factor. Contrary to conventional wisdom and belief, acne is not a sign of poor health or a consequence of dietary indiscretions, nor it is caused by masturbation or even constipation. There may be a hereditary factor. If one of your parents had acne, there is a good chance you will have it as well. Other factors linked with acne include certain medications such as oral contraceptives, corticosteroids, vitamin B12 and lithium. Also, grease, cosmetics, tight clothing or anything that can block your pores can cause acne. In some instances, stress, exposure to dioxin, a contaminant found in herbicides, or even climatic changes may trigger an outbreak. Now, let us know the complications. Acne is not life-threatening and a mild outbreak will clear up by itself. However, if acne causes emotional distress or if it worsens, take the medical help. Now let us know the home remedies. Wash daily but not roughly or too often. Use ordinary soap and water. Don't waste money on medicated cleansers because the medication just rinses away, or even granular facial scrubs. In fact, a washcloth does the same job. And facial saunas, actually facial steam baths, may aggravate acne. So be aware of all these things and watch what you eat. There is no scientific proof that nuts or colas can trigger flare-ups, but if they or other foods seem to act as a trigger for you, there is no harm in avoiding them. Numerous studies have failed to show that even large amounts of chocolate trigger outbreaks of acne. A few people are allergic to chocolate and may develop a rash when they eat it, but remember, that's not acne. And get your rest. This is most important. Flare-ups may also be related to emotional upset and too little rest, at least in some people. And change your exercise speed or gear. Working up a sweat exercising while wearing tight-fitting, non-absorbent cloths or sweatbands increases oil production and may contribute to acne. And take care of your hair. Style your hair away from your face to keep your complexion free of scalp oils and avoid greasy hair dressings. Pull your hair away from your face when you sleep and use water-based makeup. Oil-based cosmetics can block sebum from naturally reaching the skin surface. Skip cosmetics entirely if acne is severe. When buying makeup, make sure it's non-comedogenic or non-acne-genic. Be sure to remove all cosmetics with soap and water before going to bed. Don't overdo this moisturizing. And avoid prolonged exposure to the sun and ultraviolet lamps. These light sources sometimes work to dry up acne, but they can cause long-term skin damage, which can result in skin atrophy and even cancer, and thus are ill-advised. and don't pick at your face. Squeezing and picking increase inflammation and the risks of pitting and scarring. Now, let us know the warning signals. Acne can be emotionally upsetting and in severe cases disfiguring. Take medical help if you have acne that is making you self-conscious, depressed, frustrated or embarrassed, or if your acne is typified by cysts or nodules, or if unexplained symptoms develop after taking allopathic acne medication. And now let us know about the Ayurvedic treatment. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues even after using these remedies, then you need to come for personal examination and Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected based on your individual body type and prescribed along with personalized diet and lifestyle modifications. So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva Sarado Vardhamanaha. Shatam Hemantan Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.